Hi friends, welcome to Pharmaceutical Concept. Today's topic of discussion is what is the major difference between aseptic and sterile. These are the major terminologies which is used in the sterile dosage. Based on the level of microbial content, generally in aseptic condition there is absence of microorganism is there, but there is no 100% guarantee that, whereas in sterile condition absence of microorganism is ensured. So this is the major difference between sterile and aseptic. Purpose. Based on the purpose of use, aseptic condition is generally used in the food manufacturing sites, and whereas sterile condition is mandatory in the manufacturing of parentals, which is very important. Methods of achieving the sterilization is generally by using gloves, sterile gloves, wearing antimicrobial agents. The aseptic condition is, whereas in sterile aseptic condition is determined by sterilization of methods like heat sterilization, chemical sterilization. Generally, sterilization machines, UV lights and disinfections are used for aseptic, whereas autoclaves and sterilizers are used for sterilization method. Regulatory consideration for healthcare and food production, generally aseptic condition is used, whereas in medical procedures like manufacturing of sterile equipment, generally sterile condition is required. Thank you for watching this video. Consider subscribing my channel. Thank you.